Welcome, everyone, to the Solutions AMD Global Telemedicine webinar, part of our Heroes of Telemedicine series. Before we begin, let's do some housekeeping. If you should have some questions during the webinar, please post them in the Q&A panel top of the screen, and we'll address them in the Q&A portion of this event. Today, we have a very special guest, Dr. Tanya Marin, director of the Santa Teresa Day and Night Clinic based in New Mexico. But first, let's take a look at a video of Santa Teresa Clinic.
Marin Telehealth is a nonprofit organization and is owned by Tanya Marin, DNP, APRN, CPNP, PCAC. Marin Telehealth was created by Dr. Marin for the purpose of providing medical care to the New Mexico rural school districts and the surrounding community. Our mission is to make a difference in the lives of children and the community by providing quality health care in an environment built on knowledge, innovation, and honesty. We have collaborated with San Jose Wellness Center for Adult Medical Care and Dr. Christy Blanco, WHNP, for Women's and Hormonal Care. Telehealth, or also known as telemedicine, is a way for us to perform full medical exams, diagnoses, and treatments for the patient without forcing the patient or the family to travel and miss school and work. We use a specialized card through AMD and Solutions that allows us, as providers, to see the patient for a full medical exam, as if we were physically with the patient.
Wow, that's very impressive. Dr. Marin, I have to tell you, it looks like a very busy clinic. Hey, would you mind sharing with me your background?
My background, I've been a pediatric nurse practitioner for the last 20 years. I've been in the field for 25 years. We went ahead and opened our clinic in 2015. And initially it was just going to be pediatrics and night clinic. But as the needs of the community became evident, we expanded our services. My experience has mainly been pediatric, but I actually have gathered up providers to help me make sure that we meet these needs as well.
Excellent, excellent. So were you there at the very beginning of the Santa Teresa Clinic, or were you the person who started it?
I was the one who started it.
Excellent, excellent. Love innovation, love it. What types of patient care services are you providing?
So we're specifically primary care. What that means is that we're able to do full physical exams. We're able to do everything that the patient requires so that we may keep them healthy. So we do anything from vaccines to testing, lab work, to diagnosing and treating whatever it is that we're finding. And the purpose of primary care is mainly to keep everybody healthy. And that's kind of what we focus on as primary care.
Very good, very good. And I want the audience to know you're based out of New Mexico, so there's a lot going on in that state. How are you using telemedicine to reach patients?
So we actually discovered or found this equipment that is provided, that you guys created.
Mhm.
But this equipment is amazing because it has everything that you need to be able to do an in-person or an equivalent of in-person evaluation, but through the telehealth system.
Right.
And so what we've done is we place these cards in different schools. And so when the child is sick, we're able to see them, or the adult is sick, we're able to see them and help them pretty quickly with using that equipment. And so the idea here is to make sure to reach areas that are pretty remote that would not otherwise be able to maintain a clinic. And so that's really what we're trying to do is reach out and provide services to the very rural areas.
Okay. Wow. Now that's quite a demand on for services. What were some of the challenges that I'm sure COVID brought, and then post COVID, is there a difference that you're seeing?
Well, we were moving ahead with with our program, and as soon as COVID hit, we had to slow down. The whole in person and training and all that stuff had to become a lot more um, virtual, and
Mm,
so we were not as active as getting things done as we had hoped to because of COVID. But now
right.
that we're starting to become more available, now the kids are back in school, then this program has started to kick up a little bit, more pick up speed, I
Fantastic.
guess you could say. Yeah.
Yeah. Yeah. No, I get it. And I think people get it too. Um, you said you reach rural populations, and New Mexico is pretty spread out. How far do you reach?
So we have plans to reach out as far as northeast
Mhm.
of New Mexico, which is about 6 hours from where we're located.
Oh,
But all these little communities that we're trying to help are actually communities that the closest clinic or emergency room or medical help is available is about 40 miles away,
mm,
to up to an hour and a half of driving, whichever direction they would like to go. So
wow.
these are very remote areas. Yeah.
Wow. Okay. Okay. Um, is there any case studies that you could point out that stick out to you from a service standpoint?
One of the things that we notice the most with this equipment is because it's so complete.
Mhm.
We're able to do things such as spirometries, and spirometries are one of the biggest problems that children face is the asthma. And how
Oh
do
yeah.
we manage asthma and prevent them from getting sicker is by using spirometry. Spirometry is a way to test and see how bad their asthma is, and
Mhm.
it's actually a way to monitor how their asthma is doing, which allows us to um, create the treatment plan that is much more specific for the child. And so I think that having the spirometry in house where the child is located and we're able to look at them more frequently has definitely helped with the um, exacerbations, which is can be pretty devastating, and they can lose a lot of time in school, and then parents have to lose a lot of time at work. So I think this is one of the ones that I really am proud of, this spirometry service.
Wow. So you're grabbing spirometry, you're getting vitals. That's a pretty nice service to offer for, especially at the pediatric level, where
Yeah.
kids are always getting sick.
Yes. Yes.
Um, how do you see the program expanding?
So ideally, our hope is to be able to continue to drop these cards into different schools. So we hope to be able to recruit more schools so that we can put this equipment in there so we can provide services for them. The infrastructure is now set so that we can expand as needed,
Mhm.
regardless of how many schools we're able to bring on. We should be able to manage it. So ideally, we would like to see this type of services provided to as many rural communities as possible. There really
Wow.
is no limit. The limiting part at this time would be the state.
Mhm.
But do I see ourselves going past the state? Oh, that would be awesome if we could. But we are at this point concentrated in New Mexico.
Very good. Very good. Wow. What kind of specialties are provided through this service?
We have a women's health nurse practitioner that is able to take care of anything that has to do with hormones and birth control, or just women's care.
Okay.
We also have a family practice nurse practitioner that is able to take care of anybody over the age of 21,
Mm.
and it can handle anything from diabetes to hypertension to whatever the patient is requiring, the services that they're needing. We have two pediatric nurse practitioners, and I'm one of them.
Okay.
And so we're able to maintain, to take care of the children. This is from birth to 21 years of age. We
Wow.
also have a dietitian in house.
Hmm.
So if we need a child that needs, or a family that needs guidance in dietary services, we do have that available. We also have a counselor in house, so mental health is something that we can definitely address. And we're currently looking for a mental health nurse practitioner that can help us with some of
Ah,
these mental health issues that we're identifying. And so we try to provide the services that are necessary, that we identify within each school.
mhm.
So if we're noticing that, we don't have the services that we require for a particular need, then we really do look out and figure a way to either recruit the provider, or whatever is necessary so that that child may receive, or that patient may receive, the services that they need. We're very in tune with what the
Wow.
community is having to go through, and so we really want to make sure that these services are provided, and not just for the child or the teacher, but the community in general. And the truth is that you help one person, you help the whole community. So it does take a village, right?
I like
So
that. I like
yeah,
that.
so we really want to make sure that it's personable, it's specific for that patient, and so whatever needs are identified, we will try to match them with the services that we have, or refer to what we need to refer to make those services available.
Excellent. How has it been received by the patients?
I think that once they get to know us, so everybody's kind of like, what is this
Mhm.
telehealth? And is it
Mm,
really
mhm.
going to work? And what is going on here? They're not very comfortable. But once they receive the services,
Right.
once they see what we're capable of doing, and they feel comfortable with us, it actually blows up. So this
Yeah.
is very much, we do not advertise at all. It really is word of mouth. And
Excellent.
but that word
Mm.
of mouth is what allows us to grow and provide the services that we need. Um, so I think that once they get the services for the first time, they're like, oh, so this is what it means, and everybody kind of relaxes. So especially when they get to know the providers,
Yes.
and the services that we provide, they're like, oh, okay, this is not too bad.
Ah,
We are bilingual. All of us are bilingual, so the services can be pretty personal, like I said,
excellent.
for each patient.
Excellent. Wow. Um, how are the services funded?
So there's two ways of funding. One of them is for those that do have insurance, we're able to use their insurances to cover these services. These services are medical services that are approved by the insurances. So there's no, special permissions that we have to get or anything like that.
Right.
So if they're insured, then that covers those services. We fund that in that manner. But
Fantastic.
we also look into helping the indigent, those that don't have any type of medical
Mhm.
care, and so we do tap into grants for those services. What that means is that we need to make sure that we apply to the different grants that are available,
Mhm.
and we because it's a non for profit, we do qualify for quite a those.
Mhm.
But there's different grants. There's grants that help us with patient care. There are grants that help us with management, and there are grants that help us with equipment. So there's
Excellent.
quite a bit of services that we can provide through these grants, so that it's not necessarily being funded by, the patient itself. And this is what I mean by we provide services to areas that otherwise could not maintain a clinic, because
Right.
there's not enough volume, or enough insurance to be able to maintain a private practice per se. So in
Wow.
this way, we're kind of getting everybody together and maintaining a practice. If that makes any sense.
Makes absolute sense. Is there reimbursement or is that a requirement to provide service?
Okay, so there we get reimbursed for our services we provide,
Mhm.
uh, just like any other clinic does, or when you go with any other doctor.
Mhm.
Um, so as far as the reimbursement goes, that's what we get is whatever the insurance is paying.
Sure.
Um, And what was the other question?
Oh, no, I didn't know whether reimbursement was a requirement to provide service, because you, in some cases, you were stating that you
Oh,
were
gotcha.
supporting the indigent.
Yes.
And so I was just trying to figure out how that worked for you.
So those that don't have insurance, we can actually tap into the grant money, and that
Okay.
will help us pay for whatever we're using, as far as the medical services that we provide. So if they don't have insurance, it's still absolutely we can see them. It's not a no, well, you can't pay for service, we can't see you. We don't deny services to anybody, because it kind of defeats the purpose of what we're trying to do, which is reach as many people as possible. So it doesn't matter if they're insured or not, we see them.
Well, you know what? Um, I'm very proud of your program. It definitely fits into our series of heroes of telemedicine. You're doing great things there in New Mexico, and I'm looking forward to seeing this expanding. I want to say thank you for your time today. I know you are an incredibly busy doctor, and I really love the fact that you took the time to just answer a couple of our quick questions, and our audience, I'm sure, will have some questions as well. Um, Thank you for your time.
Thank you.
Today, we're going to talk about some of the applications that you can utilize telemedicine in. And here's just a few quick ones. Um, Pediatric care is what we just heard about, but it also extends itself into women's health and so other areas of care. So those, what you're identifying here are just some of the um, tools that are used. The software, the Agnes Connect software, is the bedrock by which all of this works. And then it connects and aggregates all of the medical devices, of which there's about 40 different medical devices that can be assigned to a specific area of care, pediatric being one, primary care being next, post acute care or senior and skilled care, and of course, primary specialty care. And we're seeing a growth in the area of home health care, wearables, everything from vitals, blood pressure, SpO2, and of course, temperature information that's being passed real time to the physicians. It's a critical piece of information to bring all
Norm,
this. Go
I'm
ahead.
sorry to interrupt you. Did you want to share your screen, or
Oh, forgive
we
me.
aren't seeing that? That's okay.
Is that better?
I'm sure it will pop up in a second.
Can you see my screen?
We do not.
That is very interesting.
Maybe stop sharing and then
I
reshare.
shall. I
Okay.
shall. One
Okay.
moment. Thank you for.
Yes.
Uh-huh. Okay. Let's try that again. This will probably make more sense to everyone
There you
now.
go. There you go. Yeah, we see it.
Fantastic. Fantastic.
Thank
So
you.
applications, I'm not going to rehash it, but I will simply say that the Agnes Connect software allows us to go into each one of these areas, pediatric primary care, post-acute, and specialty care, utilizing the same easy-to-use platform. That's the key here, where the doctors don't have to utilize multiple tools to get clinical information. And one of the things that we talk about is defining where the patient will be is the first way to define your telemedicine process. Will they be in a facility where you can go from room to room to room? That's one application. Or will they be at home where a telehospitalist or visiting nurse team can go and support them using the very exact software and telemedicine medical devices that were on the clinical card? Perhaps a mobile vehicle with telemedicine integrated will allow you to reach multiple communities. We are seeing a lot of that going on across multiple states around the country. Or if the patients are coming to a fixed room, perhaps a desktop or wall mount system would work. So we always like to go through and figure out where the patient is going to be in order to help provide service. One of the areas that we became very, very good at because of Solutions' capabilities of delivering grant services was Solutions helped us to target state and federal grants, which allowed the LRHA to deliver school-based health services to 26 rural communities. So in the school-based set up. Literally, students are able to hop out of class and go to see the nurse practitioner or the physician that's at the other end of the line, and then either get medication or different things that they need, behavioral health, whatever it happens to be the need for the student. At the Oklahoma State University Medical Center, they used contracted hospitalists to connect to on-site clinicians, capturing a complete medical review with the patient using digital stethoscopes, 12 lead EKGs, pulse oximeters through the Agnes software platform. And in this particular case, there was a shortage, I believe, of different materials around the country at that time, and we were able to deliver 55 carts in less than 6 weeks, full turnkey, ready to go. And of course, we're very big on training first, second, and third leg of when a person or organization brings our systems on board. And solutions is very important to that process. One of the areas that had really taken off was in the world of behavioral health and addiction treatment. Finding doctors to administer Suboxone treatment requires a special waiver, which most doctors did not have. And the ETS team utilized telemedicine to connect with the remote certified doctors that would offer prescription-based opioid treatment. That is really expanding throughout the country in ways to deliver service to that population, addiction treatment, and of course, behavioral health. So without further ado, my good friend, Kristen DeProspero, our VP of Grant and Adoption Services, will take over and introduce you to the grant management program that they are so very good at delivering. Kristen?
Thanks, Norton. Okay, you can hear me?
I can hear you.
Fantastic. So first, before I get into the funding, I want to tell everyone a little bit about who is Solutions. Since 2001, Solutions has partnered with businesses, schools, healthcare, and government entities to provide audiovisual solutions. In addition to specializing in telemedicine programs for education and healthcare institutions, Solutions is a full-service technology partner that meets the needs and budgets of organizations of all sizes. When budgets are tight, we also provide grant advocacy through our grant program services department, helping you find funding for your project. As a national company, we provide training, help desk support, equipment maintenance, and remote monitoring to detect issues. All of that is aimed at keeping your systems optimized and ready when you need them. We pride ourselves on developing interactive long-term relationships with our clients and look forward to learning how we can help your organization succeed using communication and collaboration technologies. So now what I'm going to do is get a little more interactive, and I'm going to share with you my screen on a little bit of funding that is available right now. So let's see, I'm going to share my screen. It says I can do that right here in Teams in this meeting, and I am going to present that. So I'm doing it a little bit differently than sharing the screen. It's going to PowerPoint Live. You should see it here in a second. Oh, let's not do it that way. Sorry for that. I'm going to make a quick adjustment. Let me share it a different way. Okay. So funding sources. There are so many funding sources. It is really hard to keep track. I mean, sometimes it's like searching for a needle in a haystack. But I know that Dr. Marin's group used the distance learning and telemedicine program, which you see here on my slide, which is number 1 from the U.S. Department of Agriculture. And that entire program is focused on increasing access to education and healthcare in extremely rural places. So if any of you on this call happen to be in rural areas, this could be a really good grant for you. It was just due at the end of January, which is very abnormal. It's normally due in the spring. You can get up to $1 million, and all types of organizations are eligible. You definitely have to have rural entities that are being served. You can have urban participants, though. So any .gov, .edu, .org, or even .coms can apply for this grant. And again, it's for up to $1 million for technology. This is very much a capital grant that wants to pay for the telemedicine technology. It literally has telemedicine in its name. It's a very good program for these types of activities. There is a match of 15% required for this program. So if you request the entire 1 million in the grant, you would be adding another $150,000 of your own to participate in the grant. There's also a program called the Health Connect Fund from the FCC, and they actually have a couple of different programs. And I'm actually going to go live to my screen in a minute and show you some of the content and where to find these funding programs, because like I said, it can be difficult to search and locate them. This Healthcare Connect Fund is geared towards a 65% discount on technology and equipment and network to increase your broadband and your network capability. So it's very network focused. And rural, non-rural providers are eligible, including FQHCs, and you can apply as a consortium with a group of organizations, which is recommended because you have longer term in the program, and there are a lot of benefits to being a consortium. The filing window is between December and May, so we're actually in the open window now to apply for this program. Another program is from HHS and the SAMHSA. Everybody says it a little bit differently, but that's how I say it. It's a mental health awareness training grant. .gov.org and tribal organizations are eligible, and you can receive up to $200,000 a year for 3 years. And the application deadline for this is May 1st. These are all competitive programs with different amounts of funds, and each has their own unique application process. HRSA has a school-based service expansion grant open now as well. And the organizations that are eligible need to be healthcare or health center programs under the H80 HRSA designation. If you have that, then you know what that means. If you don't, we would need to have a separate call to talk about that and how you would become an H80 type designation under HRSA. And the funding per project for this grant would be up to $350,000. And the due date, that's actually for a new school-based health program, and it's up to $250,000 for an expansion of an existing school-based health program. And the due date for that is March 31st, so it's coming up this month. So your funders, you see, can be all types of organizations. You can have federal, state, local foundations, nonprofits, as well as corporations that provide various types of funding. So what I'm going to actually do is bring over into this screen this other page and give you a couple of tips on how to find funding yourself. Now, I've got a number of these pages that I'm going to show you, and then we can open it up for questions and have a Q&A between and amongst all of us. So this is one of my favorite resources. It's called the Rural Health Information Hub, or the RHI Hub. And they have a lot of funding information. When I rest my cursor over the online library, I see funding opportunities. So that is how I got to this page. Now, what I also did is click on what's new. And this gives you any open new funding that's been posted in the last 30 days. That's important to check often because you don't always know when these are going to come out. And usually they have only a 60-day window to prepare and submit your application. I did say the FCCE had an application window from December to May. So each one of them is different. They all have their own personality, but this is a good guide and a good practice to check every week or at least every month, because there are new programs coming out and they don't always come out at the same time. So what I did was check in here and look at a few of these funding programs. I want to show you the distance learning and telemedicine one pager from the USDA. That's the U.S. Department of Agriculture for the distance learning and telemedicine grant. Like I said, you can apply for this for equipment and technology to create your telemedicine program. You really have to have very rural participants in this program to win this grant. This other program, the Rural Health Connect program, is operated and managed through the FCC. So I know that this isn't necessarily easy to read, and I'm showing you my screen. We have resources and documents to give you information on each of these funding programs, and we have a free grant advocacy program to help you look for the funding that will fit for you. So I just wanted to highlight each of these programs a little more. Now, this is the USAC, Universal Service Administration Company. You can go to usac.org and see all of their programs. If you're in the school system in K-12, you're probably familiar with E-rate, known as the education rate. And you know what? We all pay for these. We all put money into these different programs through our taxes. In this program, it's on our phone bills. If you ever look in detail at your phone bill, you'll see the universal service fee. That goes into a bucket of dollars. It's $4 billion a year, and it's to pay for network and connections to do these very types of things. So that's just a little piece of insight. There's also this option to look at funding for technology specifically for health and human services under the RHI hub. I'm going to skip over to this one. I didn't mention this in the short table, but there is the Primary Care Development Corporation financing and technical assistance. Now, this is a loan. I'm sure it's a very low cost loan, but they will provide funding to FQHCs, behavioral health institutions, AIDS services organizations, programs of all-inclusive care and elderly programs, and safety net hospitals, including ambulatory care and outpatient centers. So it's a good source of funding if you can manage the loan. And in some cases, other funding sources can help you pay back these loans. So it's dynamic. As Dr. Marin said, you want to look at all of these different programs because you're eligible for so many. I mentioned the mental health awareness training grants. This is the website for that. It was just recently announced, and it is due May 1st. Now, what's nice about this grant and so many other funding sources is right here, there's no cost share. This one has no cost requirement by you, the applicant, which is quite nice. It's a 100% grant. Also, this is another page that is about this health center program, school-based health services. So I'm kind of bouncing around, but I want to show you, where and how we can find you these programs. This is also the notice of funding, or NOFO. Sometimes it's called a NOFA, but you can find these funding sources if you follow certain search criteria, and we can help you do that. And then finally, I just wanted to share this slide or this content and show you the trends in funding have really been increasing constantly. I mean, if you think about it, certainly we had a very high increase as the pandemic hit, but it's been increasing well before that. And one of the areas of focus that's been really important is the opioid use and abuse issues. And those are resurfacing. Funding for those areas of focus are coming back and even stronger. So what I'll do here is close and just show you the solutionsinc.com website. And if you rest your cursor over the About tab, you can go to the Grant Program Services page. And that's where you can fill in the page to request funding and a free consultation. You want to click Schedule Consultation and fill in the blanks. That gives you free consultation with my team to do a very interactive search with you to find funding sources that would help your specific project. And what we do is we start off with the 5 W's, I call it, the who, what, when, where, and why of your project. Because once we know those things, we can really narrow in on what the funding sources could be to help you accomplish your goals. So with that said, I want to thank Dr. Marin and Norm and open it up to everyone on the call. If you've got some Q&A, go up to the top of your screen. You should see a Q&A button, and you can place your questions in there. And I'd also like to just thank everyone for taking time out of your day. It's an important topic. We know everyone is very busy, but there is a lot of funding to help you accomplish what you need. And there's a lot of efficient and innovative technology from AMD Global Telemedicine that can help you make these consultations with your patients and students and individuals much more efficient and helpful to them as the individuals. So Katie or anyone on our team, does anyone see any questions in queue? Or did we do just a fantastic job and no one has questions? Or everyone's over there signing up for a free consultation, possibly?
I don't see any questions yet.
Okay.
If anybody has anything and you want to raise your hand, we can go ahead and unmute your mic if you'd prefer to ask that way.
Mm-hmm.
Yeah, I'm going to unmute Anna really quick.
Okay.
Great. Anna, go ahead and unmute your mic. And you should have access.
Hello.
Hello, how are you?
I'm doing good, thank you. I do have a question. I've heard about you guys talk about Agnes Connect software. What is that exactly? How does that work?
I think that might be a me question. So Agnes software is a medical software that allows us to aggregate 40 plus different medical devices based on the care need. So you can go from document sharing, you can go to video conferencing and be able to aggregate, we'll say if you want spirometry or stethoscope or ECG, any of those medical devices to pull up a full clinical plan of care with that patient side. That also takes that information and moves it seamlessly into an EMR if that happens to be one of your requirements. So to answer your question, it's a software and we can put it on literally any piece of hardware we want, tablet, cart, wall mount system. We work up a workflow and figure out what's best solution for you, but the heart and soul is going to be the Agnes software that allows you to communicate with those remote physicians. That makes sense, Anna?
Yes, thank you.
My pleasure.
Does anyone have any questions for Dr. Marin?
I'm sorry, I do have another question.
Go ahead.
The other question is when you were talking about the behavioral health telemedicine and that, some people that do that require, there is like if they are going to administer a certain prescription drug, right? I can't, if you could remember that part, but I don't remember if you say that they need a specific license or permission to do that. And is that, have you seen anybody actually use the telemed to do that?
I think I can answer that question. So as far as how you provide services for mental health is going to be determined by your certificate. So whatever your career is. If you're a mental health provider that is allowed to prescribe, you'll be able to prescribe. The beauty of this equipment is that you're able to do a physical exam and can comfortably prescribe your opiate for the small duration, because in New Mexico we're very limited to how much medication we can provide. But as far as mental health, making sure that they're on their antidepressant or anti-anxiety or whatever medication they're on, you can prescribe it. It's not in the state of New Mexico, at least, it's equivalent to seeing them in person. So you're allowed to prescribe. So technically, what you're trying to find out is if you're a provider within the state of New Mexico and you provide services that require you to provide prescriptions, it is okay to do so in the state of New Mexico through the telehealth medicine. Does that answer your question?
Yes, thank you.
Okay. Yeah.
Okay. I think we have a couple of questions in the Q&A. I'm going to pull that up and see if I can see them. Yes, they're filling in. Okay, how does Agnes software measure vitals, etc.? Does the patient have to go somewhere with a cart in order to use these services? Norman?
So on the vital signs component, Agnes has a automated process by which you can fill in for your SpO2, your blood pressure, your temperature, pulse, weight. All that good information is captured in real time through a device and transferred instantly to the physician, the remote physician, so they can see that information for that patient before they connect to that patient and nurse professional on that far side. So they'll get a snapshot of, gee, who am I seeing today? Just like you would if you were going to your doctor and you were walking into that wonderful room and sitting down and they come in and give you your vitals review, and then the doctor comes in later, has that information. So we duplicate that process.
If I can add to what Norman is saying, so this equipment is specific. So it's it's a vital sign machine. Yep. And the spirometry is literally a spirometry. The EKG is literally an EKG. So it's everything that you would have in-house, except that now, because of Agnes, you're able to see it through real time through the internet. But all the stuff that we are doing is exactly the equipment that you will use in-house. So it's the same vital sign machine. It's the same spirometry. It's the same EKG. And as far as being there present, it works very nice if you have a medical assistant or a nurse that's on the other side that is able to help the patient position the stuff. So you have an EKG, the nurse has to put on the tabs on so that you can do the EKG. If you need to look in the ear, if you do it yourself, you're not going to be able to do a very good job, but the nurse can guide or the medical assistant can guide and do it. And you're on the other side going a little bit to the right, a little bit to the left. Perfect. I can see that tympanic membrane now. Thank you. Mm-hmm. And so it's the equipment. It's exactly what you're working on in the office, except that it's on the other side. And it's ideal if you have somebody there helping the patient get through that stuff done. there is a capability of even being able to do a pelvic exam. So again, would the patient be able to, position themselves to do a pelvic exam? No, they would need help. So ideally, you do have somebody on the other side guiding and helping that patient. So I hope that makes sense.
It does. And I think when Norman was talking about the environments where the patients are at, if it's a visiting nurse's situation and a nurse is going to someone's home, they may be connecting and using technology, let's say maybe even a stethoscope, a digital stethoscope, and they can connect with, say, Dr. Marin, and you can hear heart and lung sounds. So it's using that same technology, as you mentioned, that you use in your regular medical practice to get that feedback to the provider wherever they are. So we have another question here that says, how much does it cost to get grant advocacy support from Solutions? Well, it's free. And what we do in our advocacy is we help you find, apply, and then win a grant. So we kind of help you through that entire process. What we don't do is the writing. So I see there's another question. Do you help us find a grant writer? And yes, we can. We have been working with grant writers for several decades, and we know who specializes in telemedicine. So we would point you to them as experts if you didn't have your own internal grant writing resources. And then I see there is a comment. Okay, that was about something we already answered. Oh, there's a new post. Let's see what that says. You're absolutely welcome, Annalise. She said she didn't have a question, but thank you for the advice and information. I see that you're mentioning here that you work with a school district in New Mexico, and we have a lot of experience working with school districts. It's one of the most rewarding opportunities, I think, that we get the chance to work with, because we can see in real time the benefit to everyone involved. The administrators in the school, the students, the nursing staff, or whoever is helping from a medical point of view, the providers, and the parents. The parents really get a lot of advantage out of not having to leave work and go for any and every issue that might be able to be solved over telemedicine. And we have a new post and a new question. Oh, good. Yes. So thank you, Katie. She posted the link to the area that you would go to fill in to get your free consultation from our grant program services department. And so we can help you sort out what funding sources you're eligible for, tell you how to apply, help you through that process, and guide you on the side while you work with a writer to submit your applications. So I believe that is all we had. I want to say a big thank you to everyone involved in the background, and especially to you, Norman, and AMD Global Telemedicine for working with us on this, and Dr. Marin, Santa Teresa Children's Night Clinic. What an amazing effort and energy that you've put into all of this to make this happen, and the benefits are happening throughout your state, and we hope to help you go to other states as well.